Are you suffering from a GI disorder and you're not quite sure exactly what is going on, what this means, or what this diagnosis is? In today's video, I'm going to go through the 3 most common GI conditions I see to demystify them for you to understand exactly what it means when we say you have this condition. We'll talk about specifically IBS, irritable bowel syndrome, GERD or gastroesophageal reflux disease, and IBD or inflammatory bowel disease. So if you have these conditions or you know somebody who does, this video is for you. Guys, let's talk about food. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. I'm a board certified gastroenterologist trained at the Mayo Clinic. My passion is to give you real videos based on real evidence so you can have the right information to take care of your health. So we'll start with what's called IBS, irritable bowel syndrome. Now, IBS is a very common condition that people have. In fact, millions of people suffer from IBS. How do we actually diagnose somebody with IBS? Well, when you look at the guidelines, it is what's called a symptom-based diagnosis, meaning in the right patient, in the right symptoms, we can diagnose them based on history and talking to you alone. So how do we know if you have IBS? Well, there are a couple cardinal signs you have to have. Number 1 is some sort of abdominal pain. Now, pain can be kind of a nebulous symptom. Sometimes it's bloating or distension, but within IBS, to diagnose this, you actually have to have abdominal pain. And with that, you need to have some sort of change in your bowel habits or the bowel caliber or how your bowels look. This is the medical definition of IBS, but we know that a lot of people don't fit under this medical definition. And so a lot of other symptoms that are associated with IBS include diarrhea, constipation, or a little bit of both. I have a lot of patients with both diarrhea and constipation in the same day. It's a very common condition to have. You can also have bloating, distension, fatigue associated with IBS as well. Now, in the right patient, and we diagnose them with IBS, then we can start treatment. And what I have to clarify with everyone who has IBS is that there is no cure. And anyone who tells you there is a cure is telling you wrong information and frankly is a quack. We have no cure currently for IBS. And so we focus based on the symptoms, meaning if you have constipation, we have medications and lifestyles to treat that constipation. If you have diarrhea, we have medications and treatment options to treat that diarrhea. If you have bloating, we can focus on that. Or if you have pain, we can focus on that as well. And sometimes we do a combination of treatments, whether it's dietary options, medical therapy, psychological therapy, cognitive behavioral therapy, or CBT. There are a lot of different options that we have for IBS. And once again, there is no cure. There is no one size fits all. So it really is individualistic. And sometimes we'll need the help of multiple different specialists to get you feeling better, including a nutritionist, a psychologist, a psychiatrist, a pelvic floor therapist, and other nurse practitioners or PAs to allow us to find out exactly what is the true cause for what is going on. Next is GERD, or gastroesophageal reflux disease. So GERD is a problem in which you have acid going up into the esophagus that can manifest typically as heartburn or burning right here or regurgitation. Now, a very common confusing myth that people assume is that GERD is an acid problem. It is not. Now, in a subset of individuals, it can be. It can be too much acid or too little acid, but really GERD is a sphincter problem. You have a sphincter called the lower esophageal sphincter, which is the connection between the esophagus and stomach. And when you have GERD, the sphincter is open often and longer than other people. So it's like having a door with the door being wide open, and that causes acid to go up into the esophagus to manifest as burning or regurgitation. Now, once again, like IBS, you can diagnose somebody with GERD based on symptoms alone. Meaning, if you come to see me, you have burning right here or regurgitation, I can diagnose you right then and there with GERD. We can start you on treatment. But for some individuals, we need to take a look with an upper scope to see exactly the root cause of what is going on. Is there a hernia or is there even damage going on inside that esophagus or stomach to make your symptoms worse? And when it comes to GERD, we have a lot of options when it comes to treatment. Sometimes we have lifestyle therapy, so avoiding trigger foods, losing weight, avoiding late night meals, avoiding fatty meals helps out with some individuals. Sometimes we can use supplements like licorice, DGL, bicarbonate. And for others, we need medical therapy as well and or surgical therapy. So the treatment options can vary depending on what we find, your particular condition, and what we think the goal is when it comes to your therapy. And I have more videos on this if you want to subscribe to my channel. Last, we'll talk about IBD or inflammatory bowel disease. This should not be confused with IBS, which I just talked about. Now, IBD is not a diagnosis you can make just on me talking to you alone. You need further testing. Now, IBD is classified under 2 different conditions, Crohn's disease and ulcerative colitis. These are both IBD. What's the difference? So IBD in general is an autoimmune disease in which your body attacks itself. Now, we don't know exactly why. We think it may be a combination of genetics, maybe environment, maybe food. We don't know exactly why some individuals have inflammatory bowel disease. What we do know is your body attacks the GI tract to cause inflammation, ulceration, and a lot of issues going on inside your gut. Now, there are a lot of symptoms when it comes to IBD. It can be anemia, low blood count. It can be massive diarrhea. It can be bloody diarrhea. It can be really bad abdominal pain. It can be weight loss. It can be nausea. It can be constipation. It can be diarrhea. There are so many symptoms that are out there, which is why it can be hard to diagnose IBD based on history alone. So with IBD, whether it's Crohn's disease or ulcerative colitis, we may need a combination of taking a look with the scope, either an upper scope and or a colonoscopy. We may need imaging like a CAT scan or an MRI. We may need blood testing, and we may need stool testing, or all of the above. And this allows us to determine which particular condition that you have, whether it's Crohn's disease, whether it's ulcerative colitis. Now let's go into specifics just a little bit because I have more videos on this. Crohn's disease can affect anywhere inside the body. The most common location for Crohn's disease is typically in the small intestine, more commonly in what's called the terminal ileum, which is the very end part of the small intestine, where the small intestine connects to your colon. This is different from ulcerative colitis, in which it only attacks the colon, hence the word colitis. Now, treatment options can differ depending on what you have, whether it's Crohn's disease or ulcerative colitis, the severity of it, location of it, and your particular condition as well. But I'll tell you, in anyone who has IBD, you have to use medical therapy at first. The best analogy I give my patients is like as if your colon or your gut is on fire. There's a raging fire going on, and the only way to douse that fire is to give you medical therapy. Supplements will not work in this setting. Dietary options will not work in this setting. You have to use medical therapy. It's going to be the only way to prevent the complications of IBD from occurring. Now, once you've settled down that fire, then we have the options of adding supplements, dietary options to get you feeling better. So I hope this helped to clarify some of the confusing terminology for conditions you may be diagnosed with. If you want to learn more specifically about these conditions, I would encourage you to go through my videos where I have individual videos about these conditions. Here's my question today for you guys. What questions do you have about these conditions or other conditions I can do further videos on? Comment down below. I would love to hear what you guys have to say. Well, thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter where you can get great information about exactly what I'm talking about. Thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.